Anything said in this video is not by a medical doctor or a medical professional. Information in this video should not be seen as medical treatment, but should be seen as advice, shared experiences, and perspectives from experienced diabetics or others within the video and organization. If you have any questions regarding medical treatment, please contact a doctor or medical professional. If you have an emergency, please contact 911. Thank you. What's up, everybody? Ricardo Jr. here. Today's video is going to be an interview with Thureson. Ty is an incoming Division I lacrosse player at Providence College. He's also from the state of Minnesota. Thank you so much, Ty, for coming on.
Of course, love to be here.
No problem, no problem. So, for those who don't know Ty, he unfortunately contracted the COVID-19 virus. And, Ty, we're really sorry to hear this. I'm sure, this was a scare for not just you, but your entire family. But the reason I really want to interview you is because I'm sure you've heard that diabetes and COVID-19 have a pretty big link. There's a lot of studies and reports that diabetics are being hospitalized and killed at high rates by COVID. And, with the country seeing, record numbers and cases and, with this second wave, expected to come, the sad reality is diabetics are expected to be hospitalized and killed again at high rates with this second wave. And because of this, many diabetics have a lot of questions and concerns on what it's like if they get COVID. And even though they might have questions like, what is COVID going to be like? If I get it, what should I expect? How is it going to affect me? What should I do when I get it? And even though, Ty, you may not be a diabetic, you're going to be able to answer these questions that these diabetics have because you have the virus yourself. So you're going to give that personal experience to really connect with our audience and answer those personal questions that they have. So with that being said, let's move on to the questions. So my first question for you, Ty, is before you got COVID, did you have the thought process that COVID couldn't happen to you or that you would be fine if you just maybe washed your hands and followed CDC guidelines?
No, yeah, I definitely thought that it wasn't gonna towards the beginning, when everything happened, in March when it just kind of spread, it was going crazy. I was yeah, I'm pretty nervous. I'm gonna stay home, and then it kind of got to the point where it went away a little bit, and you're like, okay, I'm gonna go back to my life and kind of do the thing. Stuff started opening up, and then at that point, I was kind of like, well, now I don't really care. I think I almost felt like I couldn't get it. You know what I mean? I was going to restaurants, going to eat, hanging out with buddies and stuff, and it was like, oh, I don't feel that. I'm gonna get it. I guess I wasn't obviously I was cautious still to the point where you're still gotta watch out for things you're doing, but it came to the point where you're just kind of back to normal life. That was kind of what. So I guess I wasn't I didn't think that I was gonna get it necessarily, and I thought if I did get it, it wouldn't be detrimental.
Yeah. Thank you for that response. Next question. How do you think you got COVID-19 and how do you know?
So I think, I'm not sure exactly, but two of my buddies, so one of my buddies got really sick kind of over the 4th of July, and I was with him, and then he never got tested or anything, but it happened to be that he was with a kid a couple days before that ended up testing positive. And so I think I got it through him. And then actually my friend group, 4 or 5 guys tested positive. So yeah.
Wow. Yeah, that's crazy. Wow. Yeah, that can definitely be a contributor. So next question for you. How are you feeling physically while having COVID?
It was just if I had to compare it to something, it'd be the flu pretty much. Maybe a little stronger of the flu, but I've just been exhausted. Trying to go back to, I've been to the point where I'm free, I'm cleared, I can go back out and like hang out with people and stuff and like kind of, you know what I mean? But like going back and lifting and playing lacrosse has been like before I'd get through a lift and you'd be tired, you know what I mean? Then you go play lacrosse and you'd be like, oh, it's nothing. But now I'm like halfway through my lift and I'd be like, why am I out of breath? Like, why can't I, you know what I mean? And so it's just been like, physically, I've been really tired, and you could obviously see that it took a toll on like your ability to train, for me at least.
And have you been like, when you first got diagnosed, was it a lot? I'm sure it was a lot worse when you
Yeah,
first got diagnosed, right? I'm sure. Can you like, what specific like symptoms did you have physically did you have when you first got it?
yeah. The things that stood out most to me was the body aches, like body aches, sore throat, and I wasn't coughing, but I was coughing up like phlegm. I wasn't,
Yeah.
so I like get caught in my throat and I'd like cough it up. And then I had really bad chills. So I just like be laying in my bed and I'd get really cold, really hot, and then I'd like start sweating. But yeah, the thing that really stood out the most to me was the body aches, and that was not fun.
Yeah, that those sound like awful symptoms. Yeah, definitely not a pleasant feeling. Next question: how are you doing mentally through this? Are you afraid that with this virus that you could potentially end up in an ICU or even be one of those over 140,000 U.S. COVID deaths? Because I'm sure this has taken a toll on you mentally. Like, how are you feeling in terms of that?
Yeah, no, it's obviously been like a little bit of a struggle, but I think that I've had like a great support system with my mom and my dad, you know, kind of helping me and getting through it. But and for me, like I knew that I think it wasn't so severe that I was like through the thought process, am I gonna have to go to the hospital? Like I thought, like you know, I got tested and then it just kind of they said it's slowly gonna get back to normal and everything. So I didn't really have the scare, thankfully, where I was like so sick to the point where I had go to an ICU or anything like that. So I'm thankful for that. But yeah.
Yeah, that's good to hear. It didn't get to that point. Yeah, like I said before, it can be a really mental challenge. Going through a virus that's really affected many around the world. So thank you for
Sure.
that answer. Also, next question: how have you been able to keep your family members safe while having COVID?
Yeah, so I actually didn't keep them safe. They
Oh,
I'm an only child, so it's just me and my mom and my dad, and they actually both got it,
oh,
unfortunately. So but my mom's symptoms were like very mild. She like it felt like she had a cold. It was for like 2 days, and then she like not didn't feel sick at all or anything. Then she after I got tested and I tested positive, she decided to go get tested, and she tested positive. So she wasn't like sick or anything really. And then my dad thought that he should probably go get tested, so he got tested and he didn't feel sick at all, but he tested positive.
yeah. I'm sorry to hear that. That's really unfortunate news. We're really sorry. We're hoping they stay safe as well as you. What have you been doing for treatment, and is the treatment working?
I've just been resting really. I've been like really tired, just been sleeping a lot. And so they didn't really say any treatment, just like to stay away from people. Supposed to I think it was they said 10 days after your test and then 3 days after your um don't have any symptoms, like you're not contagious anymore and you can go back to slowly go back to what you were doing. So
Yeah,
I
and
didn't really have any treatment besides rest.
that's been working for you, right? Obviously,
Yeah. Mhm.
that's good. That's good. Um, Also, are there any symptoms that you had or you have that the CDC or any health organization has not been really talking about?
Um, trying to think here. Uh, I mean, the list just kept getting bigger and bigger over time, you know, symptoms, and I got it a little later. So I think at that point, like they maybe had like 12 things listed, and I probably had like 8 out of the 12 symptoms. So like there wasn't any that stood out to me that like I might have had something, but like the major ones that they had, I wasn't aware of like anything that I felt.
So like, yeah, there wasn't like any symptoms that like the CDC has been listing that you had that, people aren't expecting. It was, what it was listed on there.
Yeah, for me at least, yeah, most of it. There
Okay.
wasn't anywhere I was like, holy cow, like that's not on the list or something like that. You know what
Okay.
I mean?
hmm Okay. Um, Also, this is a really good one. Do you have any advice on how people can best prevent contracting COVID-19?
I think it's just being smart with your decisions and how you're interacting with people and how you go about your daily life. Because I know, especially kids our age, right? Like you get cooped up in the house, you want to go see your buddies, you want to go do stuff, and like you know what I mean. Especially we're going to college, we're not going to see our buddies from our hometown for a while. You know what I mean? Like, and so I think it's just being smart about your everyday decisions and how you um, put like your life at risk, but other people's life at risk. You know what I mean? Like people that decide to get tested and then go out the next day and hang out with people, like that's part of the problem. So you have to be aware of what's going on, I guess, around you. Because I'm at the end of the day, if you pick it up at a grocery store, if you pick it up going anywhere else, like you have no control over that. But you can have control over going hanging out with friends, going with family or something like that. You know what I mean? So just be cautious, I guess, and be aware.
Yeah, that's wonderful advice. Thank you so much. So that's going to wrap up all the questions we have in terms of COVID. You know, this is a very touchy subject, sad subject. But to end it off, we have a little fun question, maybe put a
All
smile
right.
on our face and get away from, the very difficult and sad conversation. So I know you're a big music guy
Yeah.
and you love music a lot. So what I'm gonna do is I'm gonna list two rappers and you're gonna tell me which one you like in terms of music or you just like in general. So the first one is
All
Tupac or Biggie.
right. I get when I was younger, I was more of a Tupac guy, but as I got older a little bit, I have to go Biggie.
Biggie.
Yeah.
Um, how about Snoop Dogg or Ice Cube?
I like Ice Cube.
Ice Cube, nice, nice,
NWA.
nice. Yeah, that's a good one. Eminem or Post Malone?
Oh, that's a tough one. It depends what mood I'm in. But if I gotta go Post Malone because he's newer, bringing more music, you know. But uh, I feel bad saying Post Malone over Eminem. Yeah.
Hey, Post Malone, not a bad answer. Good job. Yeah, that's great. Like I said, so that's pretty much gonna wrap up today. Thank you so much, Ty, for coming on. You know, I'm sure, like I said before, you're going through a lot right now, and this is a big scare for you and your family. These are very tough times, and I really appreciate your bravery and your honesty to come on this platform and really share your experience. This isn't.
Yeah.
I'm sure some of these questions were a little uncomfortable to you, because they were really, digging deep into something that has been put an obstacle in your life and in your family's life. So, I really appreciate you coming here, being honest, being
Thank you.
open about this, because, I don't think a lot of people would be able to do this. And, believe it or not, Ty, you're saving lives doing this. These, not just diabetics, but people in general, they're going to look at this and they're going to say, you know, oh wow, this kid just told me, what what it's really like having COVID-19.
For
You
sure.
know, now I know how to act. Now I know what to expect. Now I know what to do in terms of managing my health when I have it. So,
Mhm.
that's you're going to save lives, whether that's one life, 10 lives, 1,000, a million, whatever, you're still going to still stay live. So like I said before, we really appreciate you coming on here and really being open. That it takes a lot of bravery to do that. So with that being said, Ty, do you want to, have a chance to maybe spill out your social media, or if somebody wants to reach out to you if they have any questions?
Yeah, for sure. You want me to? I'll give you my Instagram.
Yeah, you just tell your Instagram handle, Twitter handle, whatever you got. If you want people to email you, call you, whatever.
Yeah, my Instagram handle is Thurs, Thurs, one, and then an underscore after. And then my Twitter is just Ty Thureson, I believe. Yep. Ty
Yeah,
T.
yeah, I'll be tagging you onto our post. Just for the audience, just follow at We Are Better Than This America on Instagram, and on Twitter, We Better America. They're all on the website too if you want to figure it out, but I'll attach Ty onto that as well. So that's going to wrap up everything. Like I said again, Ty, thank you so much. For my audience, for everybody watching, please visit the donate tab and donate, especially what's going on right now. We really need to help out these diabetics who are struggling with to afford their resources during this tough COVID pandemic. Also, and don't forget to tune in to the next video. Thank you so much, guys. Appreciate it.
Thank you, guys. Appreciate it. Thanks, Rick.